Hello, and thank you for joining me today for this video on renal physiology. My name is John Tsai from the Long Beach VA Medical Center and UC Irvine School of Medicine. Today, I'll be discussing more in depth about the interesting endocrine aspects of the kidney. In my other video, you learned about the aspects of normal kidney physiology, including how the kidneys excrete toxins, balance our electrolytes, and remove excess water. Today, we will be talking about various hormonal pathways that start with or go through the kidney. There are many important hormones that are controlled by the kidney, making it one of the most important endocrine organs in our body. Our kidneys are responsible at hormonal blood pressure control, vitamin D metabolism, and erythropoietin secretion. Let's talk about these more in depth in this video. Let's first talk about the role the kidneys play in blood pressure control through the renin-angiotensin-aldosterone system, otherwise known as the RAS system. As you can see here on the left, the kidneys are important at secreting the hormone renin in response to any decrease in renal perfusion. Renin activates the conversion of angiotensinogen produced by the liver to angiotensin 1. Angiotensin 1 is subsequently converted to angiotensin 2 by the angiotensin converting enzyme, or ACE, that is produced in the lungs. Angiotensin 2 is a primary hormone that has multiple actions that result in increasing renal perfusion and increasing sympathetic activity. The additional increase in aldosterone production also results in tubular sodium reabsorption. Angiotensin 2 is also responsible for arteriolar vasoconstriction and antidiuretic hormone secretion from the pituitary gland that results in water reabsorption in the kidneys. All this resulted in an increase in water and salt retention that results in an increase in our effective arterial blood volume, or circulating volume, and increases the perfusion of the blood to the kidney. Other hormones, specifically atrial and brain natriuretic peptides, are also closely involved with helping manage our volume status. These two peptides are produced in cardiomyocytes in the ventricles in response to stretch receptors sensing an increase in blood volume, opposite to the effect of the renin-angiotensin-aldosterone system. Atrial and brain natriuretic peptides, or ANP and BNP, result in reduction in the RAS system and an increase in glomerular filtration, ultimately resulting in the excretion of excess blood volume. While these hormones are not produced by the kidney, they are still integral in assisting the kidney in sensing the blood volume in the body and reacting appropriately to control volume status appropriately. As you may already know, we use BNP levels frequently as a way to assess volume status within the body and help drive our management with diuretics if it is elevated, especially in patients with heart failure. The kidneys are also important in regulating calcium and bone health through the activation of vitamin D. We can ingest vitamin D from supplements or manufacture vitamin D through UV light in our skin. These are considered pre-hormones and must be converted in the liver to 25-hydroxyvitamin D and subsequently converted to the active 1,25-dihydroxyvitamin D. Active vitamin D is then responsible for increasing our calcium and phosphorus absorption in the gut and maintaining good bone health. In renal failure, bone health decreases due to the lack of calcium absorption from the gut and the subsequent increase in parathyroid hormone that results in an increased risk of bone fracture. It is also important to note that without good kidney function, a patient's vitamin stores may be excellent, but the body may still show signs of vitamin D deficiency since we only typically measure 25-hydroxyvitamin D levels and not the active form of 1,25-dihydroxyvitamin D. Additionally, the lack of active vitamin D and low calcium levels also result in the parathyroid gland increasing production of parathyroid hormone. PTH also is important at maintaining bone health, and very high levels can disrupt the bone architecture, leading to an increased risk of fractures as well. Because the PTH elevation is caused by renal failure, we call this process secondary hyperparathyroidism. Lastly, the kidneys are an important source of the hormone erythropoietin, which is essential at producing red blood cells in response to anemia. In kidney failure, the levels of erythropoietin fall, resulting in lower hemoglobin levels. There are commercial erythropoietin hormone replacement therapies available now that allow us to correct anemia in the setting of renal failure and provide patients with a hormone that they are unable to produce. Additionally, there's a new class of medications called HIF prolyl hydroxylase inhibitors that actually promote native production of erythropoietin, which can help stimulate the production of red blood cells in the body. As you can see, the kidneys are actually very important endocrinological organs, producing hormones that help regulate our blood volume and blood pressure. They also help orchestrate calcium homeostasis and promote bone health. And lastly, they also help respond to low blood levels. In renal failure, any of these pathways can be disrupted, leading to what we typically see in chronic kidney disease, which are high blood pressure or hypertension, low calcium and hyperparathyroidism, and anemia of chronic kidney disease. Medications have been developed to manage complications to renal failure and help us prevent poor outcomes in our chronic kidney disease patients. That's all I have for you in this video today, but in our next video, we'll start talking more in depth about chronic kidney disease and how chronic kidney disease can affect our body.